Hey everyone, welcome back. It's time for another deep dive.
Yeah.
And today we're going to be talking about something I know you all see every day in clinic.
Demodex blepharitis.
Demodex blepharitis.
Oh.
Those little mites that can be so frustrating to deal with.
They really can be.
And, we've got the tea tree oil.
Right.
We've got the oral antibiotics.
Yeah.
But
Systemic side effects.
systemic side effects, exactly.
Yeah.
So what else is out there? Well, we're going to be talking about Lotilaner ophthalmic solution today.
Yes.
Specifically, we're going to be diving into a grade-assessed systematic review and meta-analysis that looked at how effective and safe this solution is for treating Demodex blepharitis.
Exactly. And for our listeners who really want to get into the nitty-gritty of the research,
Yes.
the link to the Phil study is in the description below.
So this study was published just last month in the American Journal of Ophthalmology. And it looked at a ton of patients, almost 1,000.
It did.
And it combined data from 4 randomized controlled trials and 2 single-arm observational studies. So they really did their homework.
They did.
To really thoroughly assess this.
Yeah. And what's interesting is that the average age in most of these studies was like 60 to 70 years old.
Oh, that sounds about right.
Right. It's like our bread and butter demographic.
Yeah, age is just a number.
Yeah.
Unless we're talking about Demodex, then it's like a VIP pass.
Absolutely.
So picture this. You got a 70-year-old patient. They come into your clinic. They've got the classic symptoms, itchy, gritty eyes, maybe some redness encrusting around the lashes. Yeah. And then you make a closer look and boom, there they are.
Those collarettes.
The collarettes.
Yeah.
Exactly. Those cylindrical dandruff-like things clinging to the eyelashes. It's like a Demodex welcome mat.
It's the hallmark sign.
So the big question is, did Lotilaner actually work? Was it effective?
Well,
drum roll, please.
I think we both know the answer to that.
I think we do. The meta-analysis found that Lotilaner was significantly more effective at getting rid of those mites compared to placebo.
Significantly more effective.
In fact, the risk ratio for mite eradication was 3.55.
Wow.
Meaning that patients on Lotilaner were over 3 times more likely to be completely mite-free.
That's huge.
Talk about kicking those mites to the curb.
Right. And we know that getting rid of those mites is like the holy grail of treating Demodex blepharitis.
It is.
Fewer mites mean less inflammation, less irritation, and happier patients.
And happier patients means
fewer phone calls.
Fewer phone calls.
Yeah.
Fewer follow-ups.
Exactly.
Everyone wins.
Absolutely.
Now, it wasn't just about the mites. Remember those collarettes we talked about?
Oh, yeah. Those were impressive results, too.
They were Lotilaner significantly reduced collarette scores compared to placebo as well.
It did. The risk ratio was 3.15 for a clinically meaningful reduction in collarettes.
So again, over 3 times more likely to see those collarettes disappear.
That's amazing. Even though getting rid of the mites is the ultimate goal, seeing those collarettes improve.
Yes.
It really makes a difference for the patients.
Absolutely. They can actually see a difference. It's not just about feeling better. It's about seeing those pesky collarettes vanish.
Exactly. And that can really motivate them to stick with the treatment.
For sure.
Yeah.
Now, of course, we can't just talk about effectiveness. We have to talk about safety.
Right. Safety first.
Especially when we're talking about something that goes near the eyes.
Absolutely. We want to make sure we're not just trading one problem for another.
Exactly. So the good news is this study showed that Lotilaner was very well tolerated overall.
That is reassuring.
It is. So what kind of side effects were we talking about?
Well, most of them were pretty mild and infrequent.
Okay.
Things like a little bit of burning or stinging when you put the drops in, some redness, maybe some blurry vision.
Okay, so nothing too crazy?
No, not really. And even chelation, which we always worry about, was pretty rare.
That's good to hear, because nobody wants to deal with a chelation.
Nobody.
So it sounds like the safety profile is pretty good.
It does. And that's really important because patients are more likely to actually use the treatment if the side effects are minimal.
Right, and if they use the treatment,
they get better.
Exactly. So it's a win-win all around.
It is.
Now, you know me, I always like to dig a little deeper.
Oh, I know you do.
And this study was specifically about Demodex blepharitis. But there's some really interesting research out there connecting Demodex to contact lens discomfort.
Oh, really? Tell me more.
Yeah, there was this study by Marcouli and colleagues, and they found a strong link between those mites and contact lens intolerance.
Wow, that's fascinating. It makes you wonder.
It does.
If Lotilaner could be a game changer for those patients who are struggling with contact lenses.
Right. Like, what if we could treat the Demodex and improve their contact lens comfort at the same time.
That would be
It
amazing.
would be like hitting two birds with one stone.
Hold on now.
Okay.
We don't want to get ahead of ourselves.
Right.
We need more research to really look at Lotilaner's effects on contact lens discomfort specifically.
Of course, you're absolutely right. We can't just jump to conclusions.
We can't.
But it's definitely something to think about.
It is. It's a really promising avenue for future research.
Absolutely. Yeah. So maybe one of our listeners out there will be inspired to do that research.
Maybe.
So before we get too carried away, let's take a step back and look at how this study actually got those results.
Yeah, let's dive into the methodology.
Okay,
Right.
let's do it.
So as we mentioned, they combined data from different types of studies, 4 randomized controlled trials, and 2 single-arm observational studies.
Okay, so a good mix.
Right. And that gives us a more well-rounded view of the situation.
It's like getting the whole picture, not just a snapshot.
Exactly. Now, those randomized controlled trials, those are like the gold standard in research.
Mhm.
So patients are randomly assigned to either get the Lotilaner or a placebo.
So it's like a coin flip.
Yeah, basically. And that helps minimize bias and ensures that any differences we see between the groups are probably due to the treatment itself.
Right, because you want to make sure it's the Lotilaner that's making the difference, not something else.
Exactly. And in these trials, patients use the Lotilaner drops twice a day for about 4 to 6 weeks. And during that time, the researchers were tracking all sorts of things like the mite eradication rates, the Collarette scores, and any side effects.
Very thorough.
They had to be. Now, those single-arm observational studies, those are more like real-world scenarios.
Okay.
So they don't have the same level of control as the randomized trials.
Gotcha.
But they still give us valuable information about how Lotilaner works in everyday practice.
So it's like seeing how it performs in the wild.
Exactly. And in this meta-analysis, both types of studies were important for getting a complete assessment.
Makes sense.
Yeah.
Now, I remember seeing something about a grade assessment in the study.
Oh, yeah.
What exactly is that?
Well, the GRADE approach, it stands for Grading of Recommendations, Assessment Development, and Evaluation.
Okay.
And it's basically a way to assess the quality of evidence.
So like a quality control check.
Yeah, you could say that the higher the grade, the more confident we can be in the study's findings.
So like a thumbs up from the research police.
Kind of. And in this case, the GRADE assessment gave the evidence a moderate rating.
So not perfect, but pretty good.
Yeah, exactly. It means we can be reasonably sure about the results.
Now, every study has its limitations, right?
Of course.
So what were some of the challenges in this analysis?
Well, one thing is that there's always some variability between studies.
Right, like they might have used slightly different methods or had different patient populations.
Exactly. And in this case, the follow-up periods weren't always the same across the studies.
So how do they account for that?
Well, they used a statistical method called a random effects model,
Okay.
and that helps smooth things out and account for the variability.
So it's like a statistical ironing out the wrinkles.
Exactly.
Were there any other limitations?
Well, some of the individual studies didn't have huge sample sizes,
Okay.
so that could potentially affect how precise the results are.
But overall, it sounds like they did a good job of addressing the limitations.
They did. They were very thorough and transparent about it all.
Now let's talk about something that's always important, safety.
Yes, we can't forget about that.
Were there any red flags that came up during the study?
Well, let's talk about that.
Yeah.
What did the study tell us about Lotilaner's safety profile?
Well, the safety data is actually pretty reassuring.
That's good to hear.
It is, especially because we're talking about a medication that goes right on the eyes.
Right. You always have to be extra careful with anything that goes near the eyes.
Absolutely. But the good news is most of the side effects were mild and they didn't last long.
Okay, so what kind of side effects did they see?
Well, the most common ones were things you'd expect with eye drops in general, like a little burning or stinging when you put the drops in.
Yeah.
Maybe some redness or some blurry vision for a bit.
Okay, so pretty standard stuff.
Pretty much. Even chelation, which can be a pain,
Literally.
was pretty rare.
That's good to know, because chalazi are not fun.
Not at all. So overall, the safety profile looks pretty good.
It does.
Yeah.
And that's important because if patients have too many side effects, they're less likely to actually use the treatment.
Exactly. And then the treatment can't work.
Exactly. So it's all connected. It is. You know, we were talking about that link between Demodex and contact lens discomfort.
Oh, yeah.
Yeah.
That Marcooley study.
Right. It really makes you think about the role Demodex might be playing in contact lens problems.
It's like a whole new perspective.
It is. And, you know, it's tempting to think that Lotilaner could be the answer for those patients who can't wear contacts comfortably.
It'd be amazing if we could treat the Demodex and improve their contact lens wear at the same time.
Right. But we have to be careful.
Yeah,
We need more research to really see how Lotilaner affects contact lens discomfort specifically.
absolutely. We can't get ahead of ourselves.
You can't, but it's a really exciting possibility.
It is. And maybe one of our listeners will be inspired to do that research.
Maybe. So let's do a quick recap of what we've talked about today.
Okay, so the big takeaway is that this meta-analysis shows that Lotilaner is effective for treating Demodex Blepharitis.
Right. It significantly reduced both mite counts and collarettes.
And that led to real improvements in symptoms.
Less itching, less grittiness, less of all the things that make Demodex so annoying.
Exactly.
Yeah.
And importantly, it did all of that with a good safety profile.
Right. The side effects were generally mild and infrequent.
So we can feel good about prescribing Lotilaner knowing that our patients are likely to benefit from it without having to worry about major side effects.
Exactly. Of course, we always need to evaluate our patients carefully and consider their individual needs.
Absolutely. Personalized care is key.
It is. But overall, Lotilaner is a really promising new option for treating Demodex blepharitis.
It is. And it has the potential to make a big difference for our patients.
It does. And if anyone wants to read the full study themselves, you can find the link in the episode description.
And if you found this deep dive helpful, we'd love it if you'd follow the podcast and leave us a 5-star rating.
It really helps us reach more eye care professionals who are looking to stay up to date on the latest research.
So thanks for joining us today. And until next time, keep those minds sharp and those practices thriving.
And may all your patients have clear, comfortable, mite-free eyes.
Yeah.